The overriding message from Tuesday's hour-long media briefing by top executives of the Ministry of Health was simply, St. Lucia is not out of the woods as far as COVID-19 is concerned. The month of May saw a sharp rise in COVID-19 cases and deaths, a trend that began at the end of April. National epidemiologist Dr. Michelle Francois says it's all heading in the wrong direction.
Over the last 28 days, we've had 414 cases. This is of significance to us because if we look at the CDC travel, the guidelines indicate that over 100 cases is considered very high risk. So we pay particular attention to this because we need to know how we are classified and how we can adjust our measures to ensure that we are not in the criteria of very high risk.
The month of May is particularly telling with the numbers trending upwards. Dr. Francois warns that there's as great a need as ever for adherence to the protocols of social distancing, mask wearing, and the washing and sanitizing of hands.
So we've had almost 20 cases a day, and this is between May 5th to May 18th. We've averaged 20 cases a day, and that has not changed for the past 14 days, sorry. If we look at our 14-day average, we have gone from 12.6 cases per day to 19.8. So in terms of that, we have moved from April 21st to May 4th, from 6.9 to where we currently are at 10.9. So there is some increase in activity in terms of the number of cases being diagnosed on the ground. And in terms of community transmission, if we go by the Centers for Disease Control, what we notice is that we are now at a substantial transmission. In terms of the total new cases per 100,000, substantial transmission would be 50 to 99. So we are not moving in the correct direction. We have been increasing cases, and this is of concern, particularly with the new variants of concern that have been diagnosed.
COVID-19 fatigue among the population seems to be setting in just at a point when the situation is becoming more complicated, with new variants being recorded.
As of May 14th, we have started climbing in terms of the number of cases. Now, with the circulation of variants within the region, within the world globally, with WHO now declaring another variant of concern in India, this is particularly concerning as we have started increasing, and we know that some of our member states have at least 3 variants to date.
Just when it seemed that St. Lucia was on the verge of turning the COVID-19 situation around, comes a rise in cases and deaths, with a population increasingly demonstrating unwillingness to adhere to the rules that are meant to keep the COVID-19 situation under control or to be vaccinated. The health authorities have the making of a mammoth challenge on their hands. Stanley Lucian for the HTS News Force.